A recent CDC study showed that natural immunity from a previous COVID infection was stronger than vaccination during the Delta wave of the pandemic. In a study from California, prior to the outbreak of the Delta variant, recent vaccination provided the best shield against COVID. That was in the initial stages of vaccination being made available. There was a study from New York which showed similar results. But by October of 2021, just a few months ago, natural immunity was 29 times more effective against COVID than a vaccine. The lowest case rates were among those who had been both vaccinated and previously infected. Joining us to discuss this, Dr. Kristin Englund. She's an infectious disease specialist at the Cleveland Clinic. Dr. Englund, good morning. These notes are of particular interest to a lot of people, definitely in relation to the Delta variant. What was your reaction when you first saw this information from the CDC?
Well, good morning. My reaction was that this makes sense. I mean, we certainly know that if someone is infected with a virus, they're going to develop a variety of antibodies in response to that infection, as opposed to our vaccines, where we really only have it developed now to develop antibodies in response to the spike protein. So as this virus changes, our natural immunity should be able to cover a wider variety of changes in the virus than it can respond to as much with just the vaccination.
But for people who are listening, and again, I think sometimes this gets lost in the translation of fear and fatigue. Getting vaccinated is essentially getting infected with a form of COVID, correct?
Very different in that if you get infected with the virus, you're going to get sick. What level of illness you get, pretty tough to be able to predict that. When you get a vaccine, you're not getting infected. You're just developing an immune response in reaction to that portion of the virus that you received.
But now we know we're getting an immune response from those who've contracted the virus, being infected or being vaccinated. Both are giving a response to the body thinking that it has the infection, correct?
Absolutely right.
Okay. So the CDC, though, wasn't recognizing natural immunity prior to this study coming out. Why?
I think we've seen other studies that have tried to compare the difference between natural immunity and vaccination as well. But certainly we want to encourage people that to protect yourself, even the best is to get vaccinated so that you never get infected at all. There are certainly downstream effects from getting from getting the infection. You can develop a serious illness. You can die from this. You can also develop long-term symptoms such as long COVID. Those you should be able to be protected against when you get vaccinated.
Obviously, being vaccinated is in a more controlled environment than just contracting the virus. Still, there are a lot of people around the country who have the antibodies. We heard that conversation so many times. I'm okay, I have the antibodies. You know, people using the term, very well-known people saying, I've been immunized. So what is this data really significant for? How can it help us in kind of moving forward as a society post-COVID-19?
So when you look at all of the data, clearly the folks who were most at risk for getting serious illness and hospitalization were those who were both unvaccinated and had never been infected previously by COVID. So we certainly want to appreciate the fact that if you've had COVID, you're going to be protected. But the question is, how long will that last? It's the same with the vaccine. How long does that protection last? And natural immunity is not felt to be lasting on the order of years from COVID, but probably on the order of a number of months. So you can certainly get even better protection if you've been infected before by getting vaccinated as well.
I know we're out of time, but I have to ask you one more question. Is the CDC recognizing natural immunity a sign that we are moving towards herd immunity?
I think certainly recognizing natural immunity is offering us the opportunity to understand that this infection has spread throughout the country and that we're going to have folks who are going to be protected against new infection from a prior infection. But vaccinations will always be the best protection.
All right, Dr. Englund, thank you so much for joining us on this topic. We appreciate your time. Still ahead. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.